We're now live.
Thank you for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretaciones al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con supervisora Lynda Hopkins.
Thank you so much, Gilbert. I'm Lynda Hopkins, Supervisor for Sonoma County's 5th District and Chair of the Board of Supervisors. Welcome to our COVID-19 and vaccination update for Friday, February 5th. As you know, we've been ramping up our vaccination efforts, and we started by prioritizing seniors ages 75 and older. These are our most vulnerable residents, and we need to give them a head start so that they wouldn't lose out on getting vaccine appointments. They also are at most at risk as we emerge from the deadliest 30-day period of this pandemic. Just this week, sadly, we've had 10 more deaths in our county, and of those, 6 were age 75 and above. Today, though, I can report that because of the progress we are making in getting our seniors vaccinated or getting them set up with appointments within the next month, starting on Monday, we are able to begin vaccinating those 70 and older. All clinics, except for one, have been directed to begin offering appointments to those 70 and older. The one exception is the clinic at the Rohnert Park Community Center run by OptumServe, which will continue to prioritize seniors 75 and older until further notice. We're also very pleased to report that starting on Monday, those 70 and older will be able to get an appointment for a vaccination at one of 11 Safeway pharmacies within our county. Each Safeway pharmacy will be able to handle up to 20 appointments a day between 9 a.m. and 4 p.m. The links for making these appointments will go up very soon on the county website, socoemergency.org/vaccine. We're also opening up in another way as well. In accordance with our objective to vaccinate our most vulnerable populations first, we have supplied vaccines to a couple of clinics targeted for specific groups within the Phase 1B Tier 1 group. For example, West County Health Centers is now providing vaccines to individuals performing agriculture, farm, and field work, collecting and processing agriculture products, including dairy, egg, poultry, and meat production, as well as individuals involved in the production of food or beverages, including wineries and distilleries. This does not include administrative or sales staff within these industries. West County has been encouraged to prioritize and target outreach to individuals who are 70 and older, and also those known to have comorbidities such as diabetes, hypertension, heart disease, and other conditions that are identified by the Centers for Disease Control and Prevention. Due to limited supply, these appointments for vaccination are by invitation only. Meanwhile, I'm also pleased to report that the Sonoma County Office of Education on Monday will begin offering vaccines to staff members over the age of 70, along with essential childcare workers who are also included in Phase 1B Tier 1. They too are being encouraged to prioritize and target outreach to individuals known to have comorbidities. Due to limited supply, these appointments also are available by invitation only. The Office of Education has been notified that it can begin vaccinating teachers the following week. Meanwhile, we continue to roll out new vaccination sites to supplement the vaccines being administered by our healthcare partners, clinics, and pharmacies. Supervisor David Rabbitt is here to talk more about that. So I'll hand it over to you, Supervisor Rabbitt.
Thank you very much, Chair Hopkins. I appreciate that. So in addition to announcing that we are opening up to those 70 and over, I'm excited to report that our newest vaccination center is going to be at the Petaluma campus of the Santa Rosa Junior College, and that will open on Tuesday, February 9th. Our partners at the Petaluma Health Center will be administering the county's supply of vaccine. We were able to secure 18 full-time staff to support the clinic paid entirely by the state. Initial appointments will be by invitation only as we reach out through the Petaluma Health Center and other groups who work with seniors in the South County to identify the most vulnerable patients. We will start with 300 vaccinations per day, but this could expand up to 500 per day depending on the supply of vaccine. In the uncertainty about the vaccine supply, we are never sure how much we will receive from the state week to week. The good thing is that that trend has been slowly, incrementally increasing week over week, but it is frustrating piece that the vaccination effort that underscores how much remains outside of control of the county. While we still have set up a historic and unprecedented vaccination campaign in really a little over a month, there are always inevitable glitches along the way. Really, these can be expected. We're standing up a program with this massive, with such a short time frame, with so many partners and moving pieces. We learn from our mistakes, we make adjustments, and we move on. The important thing is that we're making progress and that we are getting vaccines to those who need it most. The county is actually one piece of a chaotic puzzle that includes the federal and state government, our local hospitals, our healthcare providers, private companies. Unlike some counties, Sonoma County doesn't have a healthcare delivery system. We do not administer vaccines. We help with the logistics of setting up vaccination sites, and we deliver our allocation of vaccines to healthcare partners who do the actual vaccinations. Another unknown factor in our local vaccination effort is the news that the state will be contracting soon with Blue Shield to be the third-party administrator to oversee vaccine distribution. In theory, this will centralize the vaccine distribution, but we are still unclear what role the county will play as we seek to preserve and develop the partnerships that we have created. I look forward to learning more about this effort in the near future, as we all do. Now, I would like to turn it over to Dr. Sundari Mase, our health officer, to give an update on the pandemic. Dr. Mase?
Great, thank you so much, Supervisor Rabbitt and Chairwoman Hopkins and everybody else, and all of you that are listening in. Our case rate continues to come down, which is a positive sign, but we still remain, for now, in the most restrictive purple tier of the state's blueprint for a safer economy. Sonoma County's adjusted new case rate per 100,000 residents per day is now 26.9, and that's down from 34.3 just 5 days ago. But it is still well above the 7 new cases per day per 100,000 we need to move into the less restrictive red tier. Another good thing is that our testing positivity rate is now 5.8%, and that does put us in the next less restrictive red tier once our case rate comes down. We also need our test positivity of those in the lowest quartile of the Healthy Places Index, the measurement of COVID-19 response equity, to be below 8%. And today it's 10.8%, but that is also down from the previous week. So we're definitely making progress, but we still have a ways to go before we are into the red tier and making progress to get out of the pandemic. As you know, vaccines are still not widely available. Because of this, we do encourage you to still continue with all the healthy mitigation measures and practices to keep our community safe. Wear your mask or facial covering whenever you are outside of the home, within 6 feet of others whom you don't normally live with, and maintain that social distance whenever possible of 6 feet. Adhere to all the hygiene measures, wash your hands frequently, and get tested. And most importantly, don't gather in groups of non-household members. The last point is especially important because we're heading into Super Bowl Sunday. And just want to remind you that we've seen surges in cases after every holiday or every big event during this pandemic because people have gathered with non-household members. I want to remind people to forego the Super Bowl parties this year or do them virtually by Zoom and get together with friends in that way this year. Finally, I want to mention that another key tool to help us slow the spread of virus is to get tested. I encourage you to go to socoemergency.org for more information about testing sites and how to make an appointment. This is especially important because the more testing we can do, the better adjustment factor we can get for our case rate, and the sooner we can get that case rate down so we can get into the red tier. Now I'd like to turn this over to Dr. Shende to give an update on our vaccine distribution strategy.
Thank you, Dr. Mase. So as of today, the latest update shows that overall 53,713 vaccine doses have been administered in Sonoma County. That equates to at least 10%, if not more, of our eligible population over the age of 16. So it is significant. Of course, we have a long ways to go, but it's significant that we have managed to vaccinate at least 10% of our population in about 5 to 6 weeks. The number of residents who've received their first dose is up to 33,045. The number who've received 2 doses is up to 10,334. We have several vaccination sites up and running, and we'll be opening more within the next 2 weeks as we move into our 70 and older population. For a complete list of all the clinics that we have available, please go to socoemergency.org/vaccine. Besides clinics currently operating at the Rohnert Park Community Center, Sonoma County Fairgrounds, Grace Pavilion, Oakmont Burger Center, Annalee High School, and Guerneville School, the county will open 3 more vaccination centers for seniors over 70, as well as food and agriculture and childcare workers. They are the Petaluma campus of Santa Rosa Junior College, opening on Tuesday, February 9, Huerta Gym in Windsor, opening Wednesday, February 10, and the Sonoma Veterans Building, opening Tuesday, February 16. Appointments at these new sites will initially be by invitation only, giving us time to identify the most vulnerable population groups first. Once again, our ability to vaccinate is limited by our supply, and hence the need for these prioritization groups. These are in addition to vaccinations that are being administered in Sonoma County through hospitals and healthcare providers such as Kaiser, Sutter, and St. Joseph, as well as those administered through our federally qualified health centers and through the federal partnership with CVS and Walgreens, which is responsible for vaccinations at skilled nursing facilities and residential care facilities. As I said, everyone is encouraged to go to socoemergency.org/vaccine for up-to-date information on the progress of the rollout, as well as information about options for getting a vaccine, and as well as about how to volunteer. Thank you all.